Hi, my name is Daniel Joe. I'm a third-year Western University medical student.
And I'm Josie Straith. I'm a third year also at Western University.
So today we're here to talk to you about dealing with difficult patients here at Dr. Ben-Zur's office.
All right, so the first thing to cover is Dr. Ben-Zur has a wide diversity of culture and ethnicities that comes to his office. So it's very important to be culturally sensitive. If you're not very familiar with different cultures, just make sure when you go into the room to be very respectful. Try to pick up on the type of interaction that the patient wants to have with you, the interaction they have with their family members, and just be respectful of that environment. That will make them be able to trust you, want to have a good relationship with you, and also allow you to get the most information.
So going off of that, when starting a patient encounter, you'll see that there's a lot of staff within Dr. Ben-Zur's office. So one of the things that you can do to try and ease up the situation and make it a little bit less overwhelming for the patient is to just introduce yourself warmly. Say, hi, my name is Daniel. I work with Dr. Ben-Zur, and I'm here to ask you some questions to get a better history of what's going on so that we know how we can better help you today. So little things like being empathetic with a patient if they're in pain or if they have a certain complaint, or being apologetic if they seem like they're a little bit agitated. These little things can go a long way when dealing with patients who are otherwise not your typical, I'm here for a follow-up, and they have some sort of complaint, either with the office or health-related. So the biggest things is, one, being confident. Your confidence can go a long way. When you go into a patient encounter and you say, my name is so-and-so, I'm here to help you, how can I help you? If you're not fumbling over your words, if you're confident and you're choosing your words, then the patient will pick up on that and they'll have confidence in you. The second thing is, if a patient comes in with this very specific complaint and they're telling you, I don't like this about the office, or I wish Dr. Ben-Zur, for example, would see me more often, be apologetic, be empathetic. Say, I understand that that's a very difficult situation and I know it's not very enjoyable to be experiencing that, but how can we help you? And focus more on how you can help the patient rather than on what their complaint is. Of course, ask them about it, get more information about it, but then steer it towards how can we help you. One of the biggest things that you'll see is a lot of patients will comment that they don't get to see Dr. Ben-Zur much, and they'll say, will I be able to see the doctor today? Or how come I don't see the doctor much? Dr. Ben-Zur, as you'll notice, will make it a point to see all of his patients at least once, but due to some of his time constraints and because he sees a lot of patients, it's difficult for him to spend a lot of time, and it's not efficient for him to spend 2 hours with each patient. And that's where you come in as a student, because as a student, not only are you learning from the patients, but you're helping out the doctor by getting a good history and spending the time counseling the patients for him. So if a patient comes in and they ask, will I see the doctor, or how come I don't see the doctor? One of the biggest things you can say is, Dr. Ben-Zur does want to see you. He loves to see all of his patients. But how can I help you today? I would love to help you in a way so that when Dr. Ben-Zur does come in, he can know exactly how he can help you. So having that moment with them and explaining and taking the time with them as a student can go a long way and ease any situation.
During your encounter, you will always go through the medication list with the patient. You need to thoroughly go through it, making sure you know the doses, how much they're taking every day. A lot of our patients come in about 1 to 2 times per week, even every 2 weeks. So they get asked this question a lot and they start to get very frustrated. So it's very important to give them some sort of idea why it's important. We're always asking about their medications. For example, what I found to work the best is to let them know that we don't know if they've been to their family practice doctor, an endocrinologist, or the urgent care. So since their last visit, they might have received another medication and we would have no idea about that. So we like to make sure that we have all their medications, to make sure there's no interactions. And I always add at the end of everything that we're here for you to take the best care for you and to keep you healthy. That really goes a long way. From every patient I've had irritated about the medication list, they have no complaints after hearing that you want to take good care of them and keep them safe. and they usually comply and just say, okay, let's go through it. So try to explain to them why you need to do it. Don't make it seem like we have to do it every time, just deal with it type of attitude. Make sure they know why it's important, and then they'll comply. And then we also need to go over diet with them every time. You'll find out that Dr. Ben-Zur follows a vegan diet, and he likes to have his patients also try to explore the vegan diet as well for their health. A lot of patients are nowhere near vegan, and that's usually a lot of the causes of their health problems. So a lot of them aren't going to listen right away about going cold turkey into vegan lifestyle. So it's important to compromise with the patient, try to see their concerns about why they wouldn't want to change their diet, and then try to go from there to be able to decide how we can gradually cut things out of their diet and how you can replace it. And with your diet, you can give them examples of different things that you've cooked in the past to see if they can try it. And then hold them accountable to it. Say, hey, your appointment next Sunday, I'm going to ask you if you've tried this, because I want to know that you did it, and I want to see if you liked it. So that kind of holds them accountable, that they know that you're going to ask again and you do care about their health.
And then going off of what Josie just said, when talking to patients about their diet and making those recommendations, it is important that you document that within the note itself for that day. So once you get to learn how to use our electronic medical record system, there's a part in the plan that specifically talks about diet, and something that'll help you yourself as a student and future students that are coming in seeing that patient is if you specifically write down specific recommendations for diet, such as patient talked about substituting portobello mushrooms for ham in all of his dinners. And then in that way you can follow up at the next patient encounter, or the student after you can follow up at that next patient encounter and ask the patient, hey, I saw that at the last time you were here we talked about substituting your ham for portobello mushrooms. How's that going? So little things like that will keep the patient accountable and will go a long way in encouraging them to eat a healthy diet and to live a healthy lifestyle. And then the last thing that I want to talk about that kind of ties in with patient interaction and dealing with difficult patients is time management. As a student, one of the most challenging things that you'll deal with in the office is managing your time, and it's a skill that you can really develop here. And in order to make patient care as efficient as possible, you'll have to learn to manage your time. So if, for example, you see that there's 20 patients that you'll have to see in the morning versus 4 patients in the afternoon, you know that you'll have to split your time a little bit more efficiently for the 20 patients in the morning. That doesn't mean cut your interactions short, but just be cognizant of the time, and you choose your words wisely. So we do want to counsel all of our patients, and we want to give them as much time as they need, but just be cognizant and understanding of the fact that with those 20 patients, you'll have to be a little bit more efficient with your time. And then when you get to the afternoon with the 4 patients, you'll be able to spend a little bit more time with them, counseling them on dietary changes, medication changes, or answering any questions. So we hope that this video was helpful for you. We hope that you enjoy your time here at Dr. Ben-Zur's office, and that you'll learn a lot, as I'm sure that we did. Mm-hmm. Thanks. Joe, I'm a third year Western Medical student. Sorry.